Your doctor prescribes the NuLids system to patients who fall into one of two categories: those with dry eye symptoms such as irritation, itchiness, and burning, and as a preventative treatment for those showing clinical early signs of a problem but haven't progressed to the symptoms phase just yet. Regardless of what category you fall into, let's get you started back to eyelid health with some simple instructions. Before using for the first time, fully charge the handpiece. A flashing green light indicates charging. A solid green light indicates charging is complete and you can begin your first treatment. If your handpiece has been unplugged for a while, an amber light will flash when your battery is low. If this happens at the beginning of a treatment, there will be enough power to finish. Be sure to charge your device fully afterwards. A full recharge takes approximately 2 hours. Typically, your doctor will recommend starting with an indirect approach to treating the meibomian glands in your eyelids. Depending on your situation, your doctor may suggest you try the more direct approach that is described in a separate video. For now, let's get you started on the indirect approach by having a NuLids customer walk you through their 1-minute treatment.
I leave my handpiece charging overnight, so it's ready for my quick morning routine. I turn on the handpiece and then bring it close to the peg of the soft tip until it magnetically snaps into position. Then I put on lubricant my doctor recommended. I gently close one eye and place the edge of the soft tip at the intersection of my upper and lower lids, right at the eyelash margin. I press the on button to start the soft tip movement, and with steady, even pressure, move slowly to the outer corner of my eye. I continue treating the eye by moving the oscillating tip from one side of the lid to the other for 30 seconds. And the handpiece gives me a sense of when 30 seconds is up. It pauses briefly after a 15-second cycle and then starts cycling again. I move to my other eye and treat it in the same way for the final 30 seconds. Pressing the on-off button stops the device, and then I dispose of the used soft tip. That's all there is to it. NuLids. It's so easy I can do it with my eyes closed.
Depending on your situation, your doctor may recommend giving your lower or upper lids a little extra attention through a slightly different technique.
I keep the handpiece charging overnight so it's ready for my quick morning routine. I turn on the handpiece and then bring it close to the peg of the soft tip until it magnetically snaps into place. For the lower lid, I apply a lubricant to the soft tip. With my opposite hand, I pull down my lower lid while looking into a mirror. I press the on-off button and place the edge of the soft tip on my lid margin. With even pressure, I slowly move from one side of the lid to the other for 15 seconds. After 15 seconds, I'm done, and then move to treating my upper lid. For my upper lid, I gently close my eye. With my opposite hand, I pull up slightly on my eyelid to better expose my eyelid margin to the soft tip. Then it's just like before. I turn the handpiece on, slowly move the tip from one side to the other for 15 seconds, and then I'm done.
During treatment, you are massaging and stimulating the meibomian glands. There are approximately 25 to 40 meibomian glands in the upper eyelid and 20 to 30 in the lower eyelid. These glands produce oils that prevent tear evaporation and protect your eye. The soft tip movement helps eliminate debris and stimulates the meibomian glands, just like brushing your teeth near your gum line eliminates debris and stimulates your gums. Regardless of whether you're using the direct or indirect technique, the soft tip should be kept on your eyelid margin as much as possible. How you hold the handpiece depends on what is most comfortable for you. The angle of the handpiece should be one that keeps the soft tip on your eyelash margin during treatment. Doing something new can be awkward at first. You may want to look in a mirror when doing your first few treatments until you get used to the technique and the tickling sensation that may occur initially. Many NuLids users find putting their device near something they use every day is a great way to remember their 1-minute treatment.
When you suffer from chronic dry eyes all your life and you finally have something that's making you better, you make the effort to do it every single day. And it's really easy to do. If you're in the routine of washing your face, brushing your teeth every night, adding this very simple eye regimen to it is not a big deal. And it's certainly so worth it once you start seeing the results. You want to do it. It's something that you don't forget.
Studies have shown that 30 days is all it takes to create a new habit. Make the NuLids system a part of your daily routine.